Shifting focus, with a massive surge in COVID cases, China continues to grapple with the impact of loosening COVID-0 protocols that had kept the pandemic at bay. In fact, hospitals and crematoriums are completely overwhelmed in China, with hundreds of deaths reportedly taking place each and every day.
However, the official figures tell a different story, but experts are suspicious of numbers being even higher. Experts, in fact, some of them estimating that more than 60% of China and at least 10% of the Earth's population are likely to be infected over the next 90 days, with deaths likely in millions. And according to several news reports, it is the Omicron subvariant that is responsible for the COVID breakout in Beijing. Now, this variant is also said to have a higher immune escape capability, shorter incubation period, and faster transmission rate, and hence the cause of worry.
So this, of course, seems like the country is in a way paying the price for Xi's COVID retreat, as restrictions were lifted post the massive protests that have been taking place. Let's go across to Dr. Sanjeev Bagai, Chairperson of Nephron, joining us. Dr. Harsh Mahajan also joining us from the Mahajan Foundation. Dr. Sanjeev Bagai, how should the world respond, or how should we in India respond to this? Because there are reports that the number of COVID cases are now increasing in China. But in China as well, all this while the zero COVID policy that the country tried to have was not really working for the country.
Absolutely. So I think it's a combination of variety of factors. I think China as a country got the COVID strategy completely wrong right from its inception. One very major factor is that the vaccine efficacy of the Chinese-made vaccines was, to begin with, not more than 30 to 50%. And now with the Omicron new lineages, it has dipped down to 12 to 20%. So that's practically very, very low. The new Omicron sublineages, which are basically CH.1, XBB 1.5, CH 3.1, they have a huge vaccine escape mechanism, not only to the antibodies, but to the vaccines itself. So it's a double jeopardy. And the escape is as much as up to 30-fold escape. And the new sublineages are now convergent mutations. Convergent mutations means a lot of mutations are happening in a group very, very close to the N-terminal domain, away from the receptor binding domain. That's as far as the chemistry is concerned. But the prolonged lockdown is causing a selective pressure on the vaccine. It's not a good thing to do. There is no community-acquired immunity whatsoever. And now a sudden surge of this new Omicron sublineages is exposing a practically partially vaccinated, unexposed, vulnerable population towards ICUs, hospitalizations, and death. This is wrong what China is doing, and I would urge the Indian government that we must have a travel advisory so that people within and traveling to and fro from China in the last 1 month should be screened very, very carefully. Over to you.
Okay, Dr. Mahajan, what in your view can be done then? Because the zero COVID policy did not quite work for China. We saw massive protests break out, a demand that came in from each and every person residing in China that all of those COVID curbs be eased. But that in itself is not working out on ground, because there are experts who are putting out these visuals on social media saying, look how overwhelmed the hospitals are. The current situation is extremely critical there.
That's very true. Dr. Bagai has put it in very clear words. The thing is that the zero COVID policy, in hindsight, we realize has not worked. There were experts even during the time that zero COVID policy was on who were warning that little exposure to the virus would be useful. That'll help in building more robust, defense against the virus. But for reasons best known to China, they stuck with it. And when they lifted it, it has been lifted, across the whole country. Maybe not lifted completely in parts, but still there has been a massive surge. Now, we saw that with the Wuhan virus in 2020, spread from China to other parts of the world happened very fast, especially to Europe and America. And with India having a lot of travel between Europe and America, it came to India about 3 to 4 weeks later. So I think, one, we need to have some kind of a control over those who are coming directly from China or who've returned from China, as Dr. Bagai said, in the past 30 days. They need to be checked for COVID. And also, when COVID positive, whether one has symptoms or does not have symptoms, I think genome sequencing needs to be done on a war footing so that the newer variants that appear can be caught early and we can actually contain the effect in our country. Having said that, we know that the world is one. And despite whatever we may do, we still have to look at China to do more containment, and it would appear they'll have to go back to, again, the extreme restrictions that were there, which may lead to economic turmoil, but so be it. At least lives will be saved. Thirdly, I think the COVID vaccine, the Sinovac that China still continues to use, is now more or less ineffective against the new Omicron variants that are prevalent. And there again, China has developed a nasal vaccine. I think they've even cleared it. That should be given very quickly because that may lead to, stopping the disease and spread even at the nasal level where some immunity is produced. So ultimately, we have to keep our house in order and see that disease doesn't spread here. Again, we need to probably go back to more RT-PCR testing of flyers who are coming into the country. It may cause a lot of inconvenience, but I think in the weeks to come, we will have no choice if what is said about this huge wave in China is true.
Okay, so Dr. Bagai, would it be safe to say that we now have to accept that yes, COVID is going to be a part of our lives for several years to come, because initially that's what it was thought of, that COVID will continue to be something like a fever that's going to be present all through. Now there have been a lot of easing of the restrictions, especially in the country after the massive vaccination drive. But because of China, does it mean that we'll have to bring back these restrictions? That's something that the government should look at immediately?
No, I will not be too concerned. I think there should be no cause of worry or panic. We need to screen people who visited China or have stayed in China and visiting the Indian shores in the last 30 days. But having said that, it is important that to understand that the Indian vaccines have served the Indian subcontinent brilliantly. In spite of the new Omicron sublineages, and there are more than 623 sublineages, the vaccine efficacy in terms of effectiveness on ground reality is proving to keep people out of the ICU, preventing serious disease and death. Unfortunately, to begin with, the Chinese vaccines had a very, very poor efficacy, and with the new Omicron sublineages, it has gone below 20% in a meta-analysis from Cochrane. So what is important now, what China needs to do is to stop following this zero COVID policy. We don't need to hospitalize each and every patient. We need to screen them. We need to do genomic sequence. But most importantly, the president of China must get either the mRNA vaccines or the Indian vaccines. Keep lives more important rather than his ego.
So we must weigh in on these signs, but no cause of worry, because there are epidemiologists and health economists back in China who flagged this, who've said and predicted 10% of Earth's population likely to be infected in the next 90 days. Hence this conversation with you, gentlemen. Thank you for sharing all those insights. We need to head into a very quick break. News and updates continue.